I'm Dr. Raj Nagarkar, Medical Director and Chief Surgical Oncologist of HCG Manavata Cancer Centre, which is situated at Nashik, Maharashtra. First 7 years of my career, I was imparting, as I mentioned, more of a fracture treatment to my patients. In 2007, I tied up with HCG and we set up the HCG Manavata Cancer Centre at Nashik. To begin with, it was a 35-bedded surgical oncology nursing home, I would put it. But we had the first linear accelerator radiation machine for Maharashtra after Mumbai and Pune. The idea was to give the quality cancer care at the doorstep for semi-urban population of this part of the state. 2012, we had our first PET CT scan for the state outside Mumbai, Pune. And we have been moving forward technologically and protocol-driven practice, where multidisciplinary team approach has been the main foray or strength of our cancer care. In the last 10 years, we have treated almost 38,000 cancer patients, and right from day one, we have a e-data available of each and every patient, which helps us not only to assess the quality of results which we are giving, to get the geographical as well as the population-based data of the type of cancer patients which we are doing, and that has definitely helped us to frame and design preventive programs for the benefit of society. In fact, about 2 years ago, we launched this Arogya Saheli scheme with the help of few NGOs from this part of the state. When we realized that the incidence of cervical cancer and breast cancer was very high in women, but unfortunately almost 80 to 90% of them were diagnosed in stage 3 and stage 4. So we started this screening initiative where the team of doctors, healthcare workers, nurses were actually going to the doorstep of women and training them, advising them, assessing by the breast examination, colposcopic cervical evaluation. And in 2 years, we have screened almost 15,000 ladies, and we were able to diagnose 740 ladies in a primary stage because of this population-based initiative. In fact, on 1st of January 2017, it was a big day for the entire team of Curie Manavata Cancer Centre and its social initiatives, because that day we happened to enter into the book of records by screening 1734 ladies for breast and cervical cancer in one day. Challenges when it comes to a disease like cancer. Earlier, the disease which was thought about an incurable disease or definitely doomed as a death sentence when you are diagnosed with cancer. Thanks to the technology, we have reached a stage where cancer is no longer considered as an incurable disease. We have been able to convert it into a chronic disease. The challenge still remains that we need to educate the masses, we need to inculcate that trust in the society that cancer can definitely be prevented by taking care of proper lifestyle and habits. Regular exercises, diet need to be, the significance has to be imbibed in their mindset, and regular health checkups will help us diagnose early cancer. A decade or two earlier, cancer also meant lot of side effects, morbidity, and the quality of life was a concern. However, now with the advancement of technology in the form of surgical oncology tools, with the availability of robotic surgery, good reconstructive services available, and chemotherapy, radiation, newer technologies have come, we have definitely been able to improve the quality of life of a patient. So survival is no longer the only goal. The goal has shifted from survival to a quality of life advantage. Now, globally we have accepted, and there is enough data to substantiate the fact that in India, cancers tend to occur almost a decade earlier as compared to the Western population. Be it in the male population because of the higher prevalence of tobacco and its tobacco related hazards. Young victims of tobacco related oral cancers are increasing. So wherein we have to ensure that after surgical excision of the tumor, the reconstruction has to be such that that particular gentleman should be able to go back to society and carry out a physically disease-free lifestyle where he is able to take care of his family and social needs correctly. Similarly, in case of women, where more and more women are being diagnosed at a younger age group, where quite a few of them have not even started their families or not completed their families, we have to take care that they are able to complete the treatment and further take care of their family needs as well.